Much more now to our top story, which he touched on. COVID-19 cases continue to rise in all 50 states, particularly in areas with low vaccinations. According to a White House official, as of Friday, nearly 20% of the nation's new coronavirus infections are occurring in Florida alone. The CDC says almost all recent cases have impacted those who have not received a COVID-19 vaccine. Meanwhile, more countries across the nation may follow Los Angeles' lead and ramp up restrictions as the surge in new cases renews calls for more mask mandates. Let's bring in former FDA Commissioner Dr. Scott Gottlieb. His forthcoming book is titled Uncontrolled Spread: Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. I just want to start with a few quick rapid-fire questions at the top here. Do you agree with the U.S. Surgeon General that every COVID death we're seeing now could be prevented?
Most could be, certainly. 97% of the hospitalizations that are occurring right now are occurring among unvaccinated people. I mean, you will see some breakthrough infections in vaccinated people, and we're seeing that. But by and large, this is an epidemic that's occurring in the unvaccinated.
And the Delta variant, how much is it whipping through the country? And are those who are getting the coronavirus with the Delta variant younger and sicker?
Well, the people who are getting infected right now tend to be younger and not necessarily more sick. We're not sure that this variant is more pathogenic, but they tend to be younger because more of the older population is protected through vaccination. You probably have a much smaller pool of susceptible people right now. About 50% of the population has been fully vaccinated, a little less than that. And at least a third of the population has been previously infected with COVID. And it does seem to be the case that prior infections protective against this new variant. So the pool of people who are susceptible to infection right now is much smaller than it was at the outset. It's probably about 25% of the population. But in absolute terms, that's still a lot of people. And the challenge is that this variant is so infectious that it's going to move very quickly through the population. So you're going to see very brisk spread. So even though there's a much smaller pool of people who will ultimately become infected by it, because not as many people are susceptible, they're going to become infected very quickly. And that's going to overwhelm local healthcare systems, which is what we're seeing in states like Missouri.
This is being called a pandemic among the unvaccinated. But my question to you, Dr. Gottlieb, is, are vaccinated people at risk of getting COVID? Because we are hearing more and more stories of people who've gotten the vaccine who are getting COVID. Who are they getting it from?
Right, and I'm on the board of Pfizer, as you know. We're looking very closely at the data in Israel, which has deployed the Pfizer vaccine. And one of the concerns is that there's declining vaccine effectiveness against infection over time. So you're seeing more breakthrough cases over time, 6, 7, 8 months out from when people completed their original series. But the vaccine still appears to be very protective against the Delta variant. It's very protective against infection, but it's particularly protective against hospitalization and death. And if you look at what's happening in Israel and the UK right now, you're seeing a decoupling between infections and bad outcomes, people getting hospitalized and people dying of the infection. So even though infections are going up, hospitalizations aren't going up at the same slope that they did previously. And that in part reflects the fact that the vaccines are protecting people. Now, that being the case, CDC is not tracking breakthrough infections in the outpatient setting of people who've been vaccinated, and they should be. They're only tracking people who are vaccinated who become infected and then become hospitalized. So we need to be looking at this more closely.
All right, two questions that could get into the realm of politics, but I don't mean them to. Should we know who is vaccinated? Would that help?
Look, I think this is information that people can disclose at their discretion, disclose based on what they're doing. I think people should have a right to ask the question. If you're going into a setting where you could be putting other people at risk, that setting has a right to be able to ask you that question. We've seen some states, including Florida, prevent businesses from being able to do that. I'll give you one example. Hospitals. If you're going to go and visit a loved one in a hospital, the hospital has a right to restrict access to people who've been vaccinated to lower the odds that someone can introduce infection into that setting. So they're going to have to be able to ask that question.
Okay. Next question. What's the threat level of this variant and this pandemic among the unvaccinated? Should we go back to wearing masks?
Yeah, look, I don't think we're going to, is the bottom line. I don't think there's a lot of support for that because people who are very worried about COVID are vaccinated now, so you don't have support from that contingent. And people who are unvaccinated were never worried about COVID and aren't going to support mandates. I do think local regions that have very dense spread should consider the use of masks. But if you're going to be telling people to use masks, you have to be talking about higher quality masks because a cloth mask or a dust mask that you might get on Amazon isn't going to be fully protective against a much more contagious variant. We need to be talking about getting N95 masks, higher quality masks to people who are vulnerable, who want to use that mask to protect them. The other thing we ought to think about doing right now is limiting gatherings indoors in settings where you have a very high prevalence. That's really the highest risk right now, that you go into a confined space where there's poor air ventilation, that becomes a super spreading event. If, municipalities look at those kinds of events and just restrict them for a month or two while this Delta wave sweeps across the country, that could be very effective as well.
Hey, Dr. Gottlieb, Jonathan Lemire, great to see you again this morning. You mentioned your work with Pfizer. Pfizer and the federal government have had a little bit of a conversation, shall we say, in the last week or two about the need for booster shots, with right now U.S. officials suggesting they are not necessary, despite, as discussed, the looming dangers posed by the Delta variant. Can you give us an update as to where things stand and why you believe, or perhaps Pfizer believes, booster shots will be needed, if not now, but down the road?
Well, look, you're seeing declining effectiveness against infection in the Israeli data. And we trust the Israeli data. They're doing a very good job of tracking inpatient and outpatient. And they delivered the Pfizer vaccine on a schedule similar to how the U.S. delivered it. That doesn't mean that the vaccine isn't still protecting against hospitalization and death. It is. But you're starting to see more breakthrough infections in Israel among the population that was vaccinated. So they're now 7, 8 months out in some cases from when people completed this series. And so over time, you're seeing declining effectiveness. We're seeing that also in the U.S. data that we're tracking. So it's not surprising that over time you're going to see a decline in effectiveness. It might be the case that after a third booster you get a much more durable immunity. It might be the case that this becomes an annual vaccine and the length of protection is only about 6 months to a year from infection. You get residual protection against hospitalizations and more severe outcomes. But if you're going to protect against infection, that protection may not last in perpetuity. So we always contemplated that you would need boosters, or you might need boosters. We were talking about that very early at the outset. People didn't want to have that discussion earlier on, but I don't think this is a very big surprise. I don't think it represents that the vaccines don't work. It just represents that you might need an additional booster, or you might need to be vaccinated on an annual basis. Right now, I think people who are vaccinated right now are going to have a vaccine that protects them through the fall and the winter. People who are vaccinated in April and May who are younger probably also have a vaccine that's going to protect them through the fall and the winter. What we're talking about doing right now is vaccinating people who were vaccinated back in December and January. And those were people in nursing homes and more elderly people who are also at more risk of infection. And I think we ought to be looking very hard at giving that contingent boosters, because you don't want people in nursing homes going into this fall wave with declining immunity, because they're the ones who are most at risk.
And one group, of course, here in the United States that cannot be vaccinated yet are children, those 12 and under. Can you give us an update as to where things stand in terms of the timetable to when those children would be able to receive a vaccine? And as a part two of that, if it's not ready by September, would you have any hesitation, considering the rise in threat from the Delta variant, would you have any hesitation in having children be in in-person school this fall?
The vaccine won't be ready for 12 and under in time for the school season. I don't have hesitation about seeing schools resume, but I do think schools need to take precautions to try to reduce the risk in that setting. Schools aren't an inherently safe environment, but they could be made more safe with precautions that schools take. There's 3 different vaccines in development. The one that we currently have on the market, that's available for people 12 and above. That's a 30 microgram dose vaccine, at least in Pfizer's sort of situation. So for people ages 5 to 11, Pfizer's developing a 10 microgram vaccine. So it's a lower dose. And then in children ages 6 months to 4 years, that's going to be a 3 microgram vaccine. So those are basically 3 different doses being developed in different clinical trials. Now, we're talking about the vaccine that might be available for children ages 5 through 11. The data from the trial looking at that vaccine is going to be out in September. FDA has made a statement that it could be available on the market at some point in mid to late winter. I think that that's a reasonable timetable. FDA typically looks at children 12 and above as little adults, and so they're willing to extrapolate data from the adult population down to younger children. Below the age of 12, FDA generally looks at the biology as being different, and they put those kinds of products through a different development process.
Katty Kay.
Doctor, do we know if people who have been double vaccinated and catch the new variant can then transmit it to other people? And a quick second question, should people who had the Johnson & Johnson vaccine or the double dose of the AstraZeneca vaccine be now getting one of the mRNA vaccines, the Pfizer or the Moderna vaccines, because they seem to be more effective against the Delta variant?
Yeah, the first question is a great question. So they're both great questions, but the first question is really good. What we know from the vaccines is that the vaccines reduce your risk of transmitting the infection. We know that very convincingly from the existing clinical data. That's why CDC initially lifted the mask recommendation for people who are fully vaccinated. Now, if you're dealing with a more contagion variant, and that's what Delta is, and what we think is happening with Delta is that you're developing a very high viral load early in the course of your infection. So you're overwhelming your own immune system with virus, but you're also likely to be more contagious and exude more virus. So the question is the vaccine as protective at preventing transmission in a setting where you have a virus that behaves that way? And the answer may be it's not as protective. We don't know. And the reason we don't know is because, quite frankly, CDC is not tracking vaccine breakthroughs in the outpatient setting. We need to start tracking that information to see where the vaccine's breaking through, what the settings are, and if there's situations where people who have breakthrough infections after vaccination are going on to spread the virus. Right now, CDC is only tracking vaccine breakthroughs among people who become hospitalized, so they need to broaden that. That would give us a better understanding of what's going on. That's why we put so much stock in the Israeli data, because they are tracking the outpatient setting, so that's why we're looking very closely at that.